So welcome. Today we are going to discuss COVID-19 and really not more of COVID-19. It's how nutrition supports the immune system, especially at this time of COVID-19. So the topic is nutrition to support immunity during COVID-19. I know we shared a presentation, a poster saying boosting immunity during COVID-19. But boosting comes at once. But when you're talking of support, it's over a long period of time. So in this case scenario, what we are doing is supporting. So I'll go directly to what nutrition does. Nutrition has an important role in supporting the immune system and maintaining a proper immune function. COVID-19 is not a food infection. It's associated with droplets that look like flu, that appear like flu. There is no demonstration risk that COVID-19 is transmitted by food, but we must observe the hygiene. How the immune system works? Think of the body as a personal army working with the cellular to micro level. Each cell, tissue, and organ in this army plays a vital role in warding, evading pathogens, and also helps guarding against internal threats like cancer. The system has two types of response: innate and adaptive. The body's natural barriers against diseases causing intruders, for example, the skin, the mucus, the hair, the digestive acids in the stomach, those are part of the innate immune system. Adaptive immune develops over a long period of time with contact with pathogens and vaccines, preparation which help our immune system to distinguish between a friend and a foe. Possible causes of low immunity. There are some things that we cannot change about the immunity being low, and some of the causes. One is age, disease, pregnancy, and treatment. As the government of Kenya came up with guidelines, the Ministry of Health, they said people who are above 58 years of age should be working from home. Why? Because their immunity is a bit suppressed. Diseases, people who have diabetes, hypertension, some types of cancers, HIV, these are people who have a lower immunity. Pregnancy is one of the things, natural things, but also causes a lower immunity because the hormones are all over the place. Treatment, especially for the very hard kind of treatments, especially for people who have, like the chemos, the people who have cancers, people who are dealing with a skin issue like vitiligo, the treatment tends to make you have a lower immunity because the treatment is very strong. Now let's look at the things that we can change that cause a low immunity. Number one is alcohol. When you take alcohol, for some time you feel excited, you're hyper, you're happy. But at the end of the day, after taking that alcohol, you feel depressed. Probably you have dehydration, you have a headache. So it can actually cause stress, plus it reduces your immunity. Smoking is another thing that causes low immunity. We don't encourage any form of smoking, whether you're smoking cigars, marijuana, whatever kind of smoking, unless it's medicated kind of smoking, and it must be prescribed by a doctor. Nutrition, if you have a poor feeding way, your immunity also tends to be lower because you're not getting all the nutrients that you need. Exercise, WHO recommends that at least we should exercise 30 minutes every single day, at least in a week, 5 times. Stress is also another form of, another factor that causes low immunity. When people are stressed, they tend to, the body is not functional as normal, and plus even the eating habits tend to change. So this is one of the contributing factor for low immunity. Let me go back to alcohol. There are people right now, although the president of Kenya said that we should not be buying alcohol and the bars should be closed and such things. What WHO recommends And what, after doing so many researches about alcohol, the standard drink for people who cannot live with alcohol, there are people who are addicted. What cannot harm you, WHO recommends if you're a man, you take 2 standard drinks. So if you take beer, you're only taking 2 bottles of beer. If you're a woman, you will take 1 beer. If it's a man and you take wine, you'll take 1 glass of wine. But for the ladies, we will have half a glass of wine. If you take the hard liquor, let's say you're taking spirits or whiskey, you take 2 shots of whiskey if you're a man. If you are a lady, you take only 1 shot. So that's what WHO recommends after doing so many researches, and they've seen. If you take this within 24 hours, the effects of the alcohol are not as such. Yeah, but there'll still be an effect, but it will not be very dangerous. But if you must, stay away from the alcohol, and if you can, please stay away. Water for better immunity. At least take 8 glasses of water. Water is good for digestion, for breathing, for maintaining the body's normal temperature. One of the things with COVID-19, you'll have fever, so you'll need to hydrate even if you're not feeling thirsty. At least 8 cups in a day, that would be ideal, including other foods that are also in liquid form. This is a food pyramid for a normal person who has a normal weight during this time of COVID-19. And during lockdown, and you have to control your weight, you do more portion of the vegetables, then fruits, a bit of nuts and beans, the protein, then starch, and then a protein. So this is a food pyramid for weight control, because we have a lot of time in the house nowadays. This is how you should be eating if your BMI is above 24.9. Tips to live healthy and have a better immune system: cut down on your salt. Most of the ladies now that are at home, we tend to bake, because you have time, do sausages, do bacon. Cut down on these processed meals, okay? They contain a lot of salt. Eat moderate amounts of fats. Limit your sugar intake. Avoid boiled eggs. Avoid stressful eating and emotional eating. Structure your day and have a routine. When you're at home most of the time, if you don't have a planned way of when to eat and what time to eat, then you tend to snack in between the meals, or sometimes even have a meal when you're not supposed to be having a meal, which triggers you adding a few pounds, and this can be a factor that causes the immunity to be lower. Exercise, I say WHO recommends at least you exercise 30 minutes in a day, at least 5 days a week. Stress is one of the prime reasons of weakening the immune system. Reduction of stress techniques is yoga, meditation, reading a novel, or watching a nice movie. Especially during this time of COVID, when maybe you already have the coronavirus, you're at home. Keep in touch with people. Avoid watching the news that really update people on maybe the death counts and what people are experiencing with the COVID-19. Get more in touch with things that make you much happier. Choose a healthier meal, and maybe probably read a book, do the yoga. Sleep. During sleep, your immunity releases proteins called cytokines, and some of which helps to promote sleep. Certain cytokines need to increase when you have an infection or inflammation, or when you are under stress. Sleep deprivation may increase production of protective cytokines. So at least you should sleep 7 hours in a day, and especially if you already have the COVID-19. Ensure that you're getting enough sleep and hydrating yourself and having a balanced diet. Now, we have been talking of some patients that we are losing with COVID-19, what are the things that happen that cause COVID-19 patients to actually pass on? One is the blood clots, hyperinflammation, allergic reaction causing more mucus, bleeding leads to hypoxia. Hypoxia means low oxygen levels and a person suffocates. But what are the natural remedies that we can use? Zinc, number one. Okay, it helps, I said it helps with the viral infection. Vitamin C is an antiviral vitamin. So all the citrus fruits, we can have them. The zinc, we can get it from the ginger, we can get it from the nuts, we can get it from the meats products, and also milk products. Anti-inflammation, turmeric, omega-3 oils, maybe from the fish. If you don't take fish, you can get it from chia seeds and flax seeds. Some of the blood thinners that we have to eliminate the issue of blood clots, we can do a bit of garlic, cayenne pepper, cinnamon. All these are blood thinners, natural blood thinners. Hot drinks also may help with the mucus production, plus even hydrating the body, because when you have the fevers, you tend to have to be dehydrated, and maybe you're not even feeling that you're experiencing hydration. You're experiencing thirst, or you can register the thirst. So in conclusion, just eat a balanced diet during this time. It will support your immune system. Ensure that you're eating fruits, and the best time to eat fruits is on an empty stomach, when you have not had any other meal, or after eating a meal. Most normal meals will take about 3 hours. So after that meal, you can have your portion of fruit. Now, the fruits and vegetables tend to fight for us more. So at least have 2 portions. 2 portions of fruit, or 2 to 3 portions of fruit. And by portions, I mean, let's say it's in the morning, you've had an apple. Then and you've had your breakfast. At 10, you may have a pawpaw. And at 4, you may have an orange. And then 2 servings of vegetables. At lunchtime, eat your meal when it has vegetables. And at dinner time, eat your meal when it has vegetables. Remember, if you're overweight, the best way to eat is half of your plate being vegetables, and then a quarter proteins, then carbohydrates. In terms of the foods that we choose, be more organic. Go more with the natural foods that are found in Kenya. Yeah, if it's the vegetables, go more with the kienyeji vegetables, and also know where they're coming from. Yeah, because sometimes one of the risk factors is also we don't know where we're getting our vegetables from. We don't know what they're exposed to, and also ensure that you're following the protective measures. You're wearing your mask when you need to. You're sanitizing. You're washing your hands with water. It still helps. Because if you took food and you have not washed your hands, then it means you may get an infection and probably the COVID-19. Let's also not forget all the other existing conditions. We've known people who are diabetic. These are the people who should be taking care more, and also going for their clinics. Even if there is COVID-19, we may not ignore these things, because number one risk factor for a low immunity is an existing condition. And if someone who has maybe diabetes has a low immunity, so when COVID-19 comes, they may not respond to it as a person who does not have an infection. So let's ensure that if you have an existing condition, you're still doing your normal routine. You're taking your medication when you need to. You're sanitizing your hands as you go to the hospitals. You're wearing a mask. You're making sure that you're sanitizing. And that's it. With the nutrition to support immunity, that's all that I can say.